Bismillahirrahmanirrahim. Dear students, Assalamu alaikum. I am Waqar Ahmad and this is the second lecture on epidemiology of infectious diseases. In the previous lecture, we have studied about some basics and today we will study also about some more. So first, we will study about the measuring frequency of epidemiology. That how to measure the frequency of epidemiology. So the most important tool that is used for epidemiology, that is the statistic. Statistic it is the branch of mathematics in which we deals with the collection, organization and interpretation of numerical data. Now epidemiology, it was the first medical field in which statistical methods were extensively used. Now the measures of frequency, it usually are expressed as fraction. For example, 1 over 2. This is 1 over 2. The 1 is known as the numerator and the 2 is the denominator. Now what to represent the numerator? The numerator, it is the number of individuals experiencing the event. For example, a disease or infection. The denominator, it is the number of individuals in whom the event could have occurred. Now the fraction is actually a proportion or ratio, and this fraction is commonly also called a rate. Now a rate also can be expressed as a percentage. Now I will discuss that how it can be represented as a percentage. Now in population, the statistics rates usually are stated per 1000 individuals, or it may be per 100 individuals, or it may be per 10,000 individuals, or per 1 lakh individuals. Now there are types of rates. As we said that fractions are represented as rates. So what are the types of rates actually? So there are three types of rates. The first one is the morbidity rate. What is the morbidity rate? The morbidity rate, it measures the number of individuals that become ill due to a specific disease within a susceptible population during a specific time interval. So in morbidity rate, we measure the number of ill individuals in a population, that how many individuals are ill due to a specific disease or any infection. So the rate is commonly determined from clinical reports, because the clinical report will be an authentic one. So this rate is also determined from a clinical report. Now it is calculated as follows, that how we can calculate it. So morbidity rate, it is equal to the number of new cases of a disease during a specific period divided by number of individuals in the population. For example, if there were 700 new cases of influenza per 1 lakh individuals, then the morbidity rate would be expressed as 700 per 1 lakh, or 0.7%. As I said, that the rate can also be expressed in percentage. So this is the rate, the morbidity rate, that if the total population size is 1 lakh individuals and only there are 700 new cases of influenza, so the morbidity rate is 0.7%, or 700 per 1 lakh. Now the mortality rate. The mortality rate is the death rate. It is the relationship of the number of deaths from a given disease to the total number of cases of the disease. Now it is calculated as follows. The mortality rate, it is equal to the number of deaths due to a given disease divided by size of the total population with the same disease. For example, that if there were 15,000 deaths due to AIDS in a year and the total number of people infected was 30,000. Now this is the total number of population with the same disease is 30,000 and the number of deaths due to the disease, due to the given disease is 15,000. So the mortality rate would be 15,000 per 30,000, or we can say 1 per 2, or 50%. So the mortality rate is 50%. So this is the mortality rate in which we find out the death rate. Now the other is the prevalence rate. The prevalence rate, it refers to the total number of individuals infected in a population, that how many individuals are infected in a population at any time, no matter when the disease begin. We have here we cannot know about the specific time that where and when the disease starts. Now the prevalence rate, it depends on both the incidence rate as well as the duration of the illness. Now the infectious disease epidemiology. That what is infectious disease? So an infectious disease, it is a disease resulting from an infection by microbial agents, for example, viruses, bacteria, fungi, protozoa, and helminths that can be transmitted from one host to another host. So every disease is not an infectious disease. The infectious disease will be that disease in which there will be the involvement of microorganisms. Now the manifestation of infectious disease, it can range from mild to severe to deadly depending upon the agent and host. So it may be mild, it may be severe, or it may be deadly. Now the recognition of an infectious disease in population, that how we will recognize an infectious disease in a population, that either this disease is infectious or not. So the infectious disease in a population, it can be recognized by using various surveillance methods. Now what are the surveillance methods? So the surveillance methods are actually there are some factors which are involved here in the infectious disease. So the first one is the generation of morbidity data from case reports, that we generate the morbidity data. The morbidity data is, I told you, that in which we find out the ill report, the disease report. So this is the morbidity data from case reports. Now the other is the collection of mortality data from death certificates, that we also find out the mortality data but from authentic source, that is from death certificates, which are actually given by the certified hospitals. Now the investigation of actual cases, that we know about the actual cases of the disease or infectious disease. Now the fourth one is the collection of data from reported epidemics. The fifth is field investigation of epidemics, that we also know about the field investigation, that we know about the actual cases which are present. So for example, in the hospitals or in the homes or in some other areas, so where the patients are present. Now the sixth one is the review of laboratory results. We should also review the laboratory results. For example, the biochemical test, the antibody test, the PCR test, and other types of the laboratory results. It should be also reviewed. The other is the population surveys using valid statistical sampling to determine who has the disease and also to know about the disease and non-diseased persons. The other one is the use of animal and vector disease data, that either any kind of vector is involved or not. The ninth, this is the collection of information on the use of specific biologics. For example, that any types of antibiotics, antitoxins, vaccines, and other prophylactic measures are used or not, and what is its effect on the population, that either it is effective or not. The 10th one is the use of demographic data on population characteristics, such as the human movements during a specific time of the year, that either the person has moved to any place or not where there is a more chance of this disease. So this is the demographic data. Now the signs and symptoms of disease, that what are the signs and symptoms of disease? Signs are objective changes in the body, such as the fever or rash, that can be directly observed. So we can say that sign is a observable change in the body that can be observed. For example, fever or rash. Now symptoms are subjective changes such as pain and loss of appetite that are personally experienced by the patient, and it cannot be observed by the doctor. Now the stages of infectious diseases. So there are 4 stages of infectious diseases. The incubation period. The incubation period, it is the period between the entry of microorganism up to the onset of first sign and symptom. So this period is called incubation period. For example, if on first date the antigen enter into the body, and on 10 date the first sign and symptom appear, so the incubation period will be 10 days. The pathogen is spreading but has not reached a sufficient level to cause clinical manifestation. So in incubation period there will be no clinical manifestations in the patient. The second one is the prodromal stage. In the prodromal stage, it is the period in which there is an onset of signs and symptoms, but they are not yet specific enough to make a diagnosis. So the signs and symptoms will be developed in a patient, but still it will be not possible to make a possible diagnosis of a patient. Now the third one is the illness period. Now this is the phase in which the disease is most severe and has characteristic signs and symptoms. Now in the illness period there will be the clear sign and symptoms in the patient. The fourth one is the period of decline. So in this period the signs and symptoms begin to disappear. The signs and symptoms will be disappear. And the other is the convalescence. Convalescence is actually the recovery stage in which the patient is recovered back to the normal health. So this is all about today's lecture. Thanks, dear students.